Dr. David Fabi here, orthopedic surgeon, hip and knee replacement specialist here in lovely San Diego. So with regard to hip replacements, the company that I use and the implant that I use, it's the DJO implant system. It's their FNP acetabular cup, which is the socket component, and the lateral taper fill stem, which is the stem here, the component for the femur, the thigh bone, the upper end of that bone. Why I love it, I perform what's called an anterior approach, meaning we're doing the approach to the front of the hip. A lot of advantages to that. We're going in between muscles rather than cutting through muscles. So the recovery in most studies demonstrates that it's quicker. Furthermore, it's less prone to dislocation because a hip replacement can dislocate. So the question is, why do I love this implant? One, it functions very well, it works very well, and two, it's more friendly and more efficient and easier to use for the direct anterior hip approach. So got great instrumentation, so I've been using it for multiple years with excellent results.